There were two moments within the first 15 minutes of Robert F. Kennedy Jr. squaring off against the Senate committee that really set the stage for what was about to unfold over the next 3 hours.
Prior authorization, information blocking.
Secretary Kennedy interrupted just 2 minutes into his opening remarks, reportedly by a woman in a wheelchair who had to be escorted out.
The committee will come to order.
And just before that, the ranking member on the committee, Democratic Senator Ron Wyden, effectively accusing Kennedy of lying before he had even said a word.
Mr. Chairman, and I think it is unfortunate that I have to do this. I would ask now that the committee formally swear in Robert Kennedy as a witness.
To be clear, this is, at best, unusual, at worst, insulting, to ask for a sitting secretary to be put under oath in this setting.
Senator Wyden, I will personally object and will reject your request. We will treat this witness as we treat all of the other administration witnesses who come before us.
So, no oath. But you see how hostile this was about to become, and not just along conventional political lines, Democrats against Republicans. Senators from both parties were demanding answers.
You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that.
Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned.
Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it.
You're interrupting me, and sir, you're a charlatan. That's what you are.
How can you be that ignorant?
I think that most people will probably see the hearing and see that Kennedy was not able to answer very pointed questions about the job that he's doing as the head of the Department of Health and Human Services. But I think there was another group of Americans, including President Trump, who saw that hearing as another example of Kennedy battling the elites.
If Democrats were keen to put Kennedy under oath, it may have been because they say he lied back in November when he was first being considered for the job.
Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away.
If vaccines are working for somebody, I'm not going to take them away.
No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them.
But Kennedy is arguably doing the opposite. Just last week, he announced that COVID vaccines are no longer approved for most healthy people under 65. Vaccine makers like Pfizer announced this as well, and it builds on a broader campaign to limit who gets the vaccine.
I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
Now, Kennedy still says he's not taking anyone's vaccines away.
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No.
So they're both right in a way. Anybody can get the booster in the United States, but what's changed is that depending on what state you live in, and now depending on what your age is too, you may not be able to get it for free because it's no longer mandated. And when otherwise it costs potentially hundreds of dollars for the shot, Democrats say that amounts to taking the vaccine away from people who are no longer eligible but who still want it.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, I never promised that I was going to recommend products with which there is no indication. I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
But let's try to understand Kennedy's position here, because he did explain it a bit more when answering a Republican senator.
Right now, we're dealing with completely different circumstances, where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity.
And this is all true. There is much more immunity in the US population than there once was. Just think of how many people have already gotten sick. So, he argues, we shouldn't be giving vaccines to otherwise healthy people, especially without rerunning clinical trials for each new formulation. But he's leaving out an important distinction, because COVID vaccines are more seasonal now, like the flu. And in those cases, labs don't generally just rerun clinical trials like he's suggesting that they do, because those can take years. And if you went completely back to the drawing board with every new strain, you would just miss the boat every time. So instead, labs study whether new vaccines are producing the right antibodies for the right strain. That's considered good enough, and around it went.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month.
We are the sickest country in the world. That's why we have to fire people at CDC.
Kennedy has stated, for the record, that he considers the U.S. Centers for Disease Control the most corrupt health agency in the country. Maybe even the most corrupt government agency, period. Drug pushers beholden to Big Pharma. But some Republican senators in particular seem to question whether the changes Kennedy has made in public health since becoming health secretary are more to blame.
I support vaccines. I'm a doctor. Vaccines work. I've grown deeply concerned. The public has seen measles outbreaks, leadership in the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired.
What he's referring to in that last part there is Kennedy's decision to fire Susan Menares, who was confirmed as head of the CDC just 1 month earlier.
Hi, I'm Robert F. Kennedy Jr., your HHS secretary, and I'm here with Dr. Susan Menares, who is our new CDC director.
And she seemed like she'd be there for a good long time. At her swearing in, Kennedy boasted of her unimpeachable scientific credentials. Then the hammer dropped. In an opinion piece in the Wall Street Journal, Menares says she was fired for insisting on rigorous scientific review. She explains in a bit more detail further down. I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric. Kennedy disputes this, says it's not true, but she's nodding to two things there. The first is that this Advisory Committee on Immunization Practices, or ACIP for short, it's a committee that advises the CDC on vaccines. It's a key role in setting vaccine policy, and they're scheduled to meet later this month to review and maybe reconsider a number of existing approved vaccines.
You said that ACIP is an independent panel after you stocked it with your picks.
In June, you fired all 17 committee members who were respected scientists and doctors. You replaced them with non-experts, vaccine skeptics, and conspiracy theorists.
If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
No, I don't. It may be a bias, and that bias, if disclosed, is okay.
Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it.
Well, let's sort through what's true and what's not. It is true that Kennedy swept out every single member of this vaccine advisory panel.
There are panels that are made up of outside individuals, outside experts who come in to set policies. In the past, those people, almost all of them, have severe conflicts of interest.
That's not true. At least not according to a report Kennedy himself has cited in making this case. Now, to be fair, this 20-year-old report did find lapses in procedure. Paperwork errors in the financial disclosures of almost every single special government employee it considered. It also found most of these employees had unresolved potential conflicts of interest, and a big chunk of them hadn't received the proper ethics training. But that ultimately when it came to actual conflicts themselves, only 3% of special government employees voted on particular matters when their waivers prohibited such participation.
He believed there was conflict of interest on that panel. Now, that's something that public health experts had pushed back on. This panel, they meet several times a year, and they generally disclose conflicts of interest at the start of the meeting.
Then we get to the question of claims made by people on Kennedy's new vaccine panel.
Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children?
Senator, are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply...
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire...
You're evading the question.
No, I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions,
I
Mr.
asked you a
Kennedy.
question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership.
There was this stark display this week where Washington, Oregon, and California announced a coalition to make recommendations to counter what the Trump administration has been doing. On the other hand, Florida announced it would become the first in the nation to end all school vaccine mandates. These changes, some states sort of breaking from the federal government, it's unprecedented, and some public health experts fear it could cause confusion among patients and doctors, etc.
For the record, there are documented harms and injuries from COVID vaccines, including heart issues in rare cases, as Kennedy points out. But study after study has shown the number of lives saved by the vaccine vastly outnumber those lost to it.
There's lots of research out there that shows that the fact that millions upon millions of people got these vaccines, it is proven both in terms of the scientific experiments and in terms of like real world practical assessments of what's going on, that these vaccines do work.
What's important to remember about these hearings is that they can sometimes, maybe often, be more spectacle than substance. Each senator has a fairly strict 5-minute time limit to ask questions. And because it's not always easy to get a straight answer in that time, senators often speak far more than they listen. And the message, from Democrats at least, that RFK Jr. was a bad pick, that Republicans should feel bad for picking him. And by the looks of it, at least some Republicans agree. What is unsaid in all of this is how this all reflects on the man who put Kennedy's name forward in the first place.